work. So what are the parameters that were there and that is there in the reference criteria? The first is the risk. So serum creatinine greater than 1.5 times the baseline value, or there is greater than 25% reduction in the GFR. And important one more point is urinary output criteria. So we have also discussed in our previous sessions, when, if you remember, when we discussed the respiratory system critical examination and everything, when we discussed even the sepsis and the shock. So the normal urine output should be greater than 0.5 ml per kg per hour. But if it is less than 0.5 ml per kg per hour for continuous 6 hours, that falls into the risk assessment or risk criteria of this reference criteria. The second is the injury. Creatinine greater than 2 times the base limit or GFR greater than 50% reduction. Urinary output less than 0.5 for 12 hours. Failure 3 times the baseline serum creatinine. And GFR greater than 75% reduction. But one more important parameter, if this is not being there, then you have just serum creatinine greater than 4. And more falling of the urinary output less than 0.3 in 24 hours, or anuria, complete absence of urine for 12 hours. Loss, so persistent acute renal failure, complete loss of function for greater than 4 weeks, and end stage renal disease for greater than 3 months. So for referrals, increase in serum creatinine should be both abrupt, that it should be rapid within 1 to 7 days, and sustained. That means it should be prolonged, that is greater than 24 hours. The AKIN criteria includes the stage 1, 2, and 3. So in stage 1, when we talk about serum creatinine greater than equal to 0.3 mg per dl or greater than 1.5, the upper normal baseline value, but it is less than 2 point the baseline. So greater than 1.5, greater than equal to 1.5, and less than equal to 2 times the baseline. Urinary output again less than 0.5 for 6 hours. For stage 2, creatinine greater than 2 but less than 3, and urine output less than 0.5. And stage 3, creatinine greater than 3 or creatinine greater than equal to 4 with acute rise in greater than equal to 0.5 mg per deciliter, or if the patient is on renal replacement therapy. So this is the stage 3. But if you look into the urine output, it has fallen more, that is less than 0.3 ml per kg per hour for 24 hours. So from 6, 12, and 24, and complete absence of urine for 12 hours. So increase in serum creatinine must occur in less than 48 hours. So this was the reference criteria, and the second is the you have the AKIN criteria, which we discussed. AKIN. So reference criteria consist of 3 graded levels, which we have discussed. So what are these 3 graded levels when we talk about? So it deals with 3 graded levels which are being there. So risk injury failure, and based on the magnitude of elevation in the serum creatinine or urine output, 2 outcomes are measured, like loss and end stage renal disease, and referral strata are as follows.